George Harrison and Got My Mind Set on You here on 1FM 91.3. Wonder if he was talking about chocolate cake. Maybe not. Good morning. Welcome to the Brightside. You're hanging out with Carol and Shehzad and joined in the studio by Dr Alan Cheung.
Yeah, he's the Senior Consultant Orthopaedic Surgeon and Singapore Director of the International Orthopaedic Clinic. Very good to have you here with us.
Thank you so much. It's great to be here.
You know, we've already kind of discussed the effect of COVID and people getting back to sport, professional athletes and how they get injured. We've also had now Daniel Ng has a message to say he wanted to find out about plantar fasciitis, which is something I've also had.
Sorry to hear.
Yeah, and really painful. That's, of course, a problem in your heel and the sole of your foot. And he's saying, how is there any home healing? Because he wants to continue his basketball activities.
Okay, well, thanks very much for the question, Daniel. I'm sorry that you're having pain in your foot. Your basketball is probably the reason why you're getting the plantar fasciitis. The plantar fascia is a thick layer of tissue which helps support the arch of your foot. And where it inserts into your heel bone, sometimes if you do a lot of repetitive running or jumping activities, it can get inflamed and very painful, particularly when you get up in the morning and take a few steps. So I suggest that you take a break, maybe cross-train with another thing like swimming or even cycling. You can take some anti-inflammatories if you are not allergic to them. You can put a can in the fridge and cool it down and then roll it underneath your foot. That can often provide some good relief. And one exercise which is good is to sort of pull your toes back to increase the arch of your foot. That's a classic exercise for plantar fasciitis. And usually that does the trick, but if it doesn't, then best to go and see a specialist or a physiotherapist to take a closer look.
Yes, like Dr. Alan.
Exactly.
Naming no names.
Just one other thing that I was also told, Daniel, by the way, and was to not have if you sleep with a cover, to not have it tightly bound in, because it kind of pushes your foot forward. That was, I don't know, something I was told, just to keep your blanket nice and loose at night.
Nice and loose blanket.
Yeah. But that was a little thing. But it was really painful, the therapy I used to do. I used to kind of use this shockwaves. The shockwaves.
Yes,
Ow!
Right.
But it was effective. It was very effective.
On the topic of sports injury, how do we further prevent damage to a joint or muscle?
Well, that's a great question, Carol. And back in the old days, we'd say RICE, which is rest, ice, compression, elevation for a fresh injury. Nowadays, we tend to use something called police, where we protect the injury and use optimal loading. So that means don't completely rest it, but you can do some gentle movements and exercises to try and rehabilitate yourself to replace that resting component. If your injury is severe, then you can't walk or you can't use your arm and the area is very swollen and deformed, it's best to seek immediate medical attention because you might have broken a bone or dislocated a joint. If you feel the injury is less severe but persists after several days despite protecting it, and then you can't play sports, for example, then please see a specialist, as if you leave it alone, it may become a more serious and chronic injury. Overall, if in doubt, see a specialist.
There you go. The long and short of it is see a specialist. Something I should have done, I was telling you this, like 20 years ago, I actually kicked the ball. It hurt the side of my toe.
Ouch.
And 20 years later, it still hurts. Like when I run too much or I wear heels or something like that, I get up and it's like actually a sharp pain. I've ignored it for 20 years. I've never actually gotten it x-rayed.
If only you were talking to a doctor.
I know, right? Where were you 20 years ago, Dr. Alan? I probably needed your help or just a nudge to go get something done.
But I think this is an interesting point that Carol brings up, because
a lot of people are probably like that.
Yeah. They have this niggling pain that they kind of just ignore, maybe through a sports injury. But should they should just address
Asian,
it, right?
It's quite Asian. Singaporeans, they don't like to see doctors.
Well, I've noticed that, we all lead very busy lives, for one, and it's sometimes tough to take the time, and obviously, for a lot of strong people, so you're able to put up with that pain and live with it for so long. It's true,
I cry every night.
But again, at the end of the day, you've got to take care of yourself. Your health does matter.
Right.
So, take that time to look after yourself and get it checked out.
So this is something you've experienced where maybe patients have come to you with something that they really should have come to you way, way before.
Yeah, I mean, at the start of COVID, going back to COVID, people have held on to injuries for 2, 3, 4 years.
Right.
And when they had all this time they said, "Doctor, please check me out, fix me." And there's so many people. That's when they just had the time to look after themselves. And look after
Yeah, it's
their
funny
bodies.
how it took COVID for people to actually start paying attention to all their pains and aches and all that.
And I bet once you've sorted it out, they're like, "Oh my goodness, why didn't I do this all that time ago?" Right?
It can happen that people say, "I wish I'd." With hindsight, when people put up with an injury for a long time and get it fixed and they're much better, they say, "I wish could have checked out and sorted a long time ago."
You got to sort yourself out, Carol. Come on.
Exactly, and we're talking to Dr. Alan Cheung, and of course he's the director of the International Orthopaedic Clinic over at Mount Elizabeth Novena Hospital, which he describes as a hotel.
No, it's not a hotel.
It's pretty swanky over
it's
there.
Amazing. It's an amazing facility.
All right, we'll be back with more of Dr. Alan in just a bit. Keep it right here. It's 1FM.
There's nothing like the right music at the right place.
Can't see the feet though.
Thanks.
It's on 1FM.
Oh, cool. Okay.
You're
Oh,
welcome.
yeah. Here we go. Yes. Okay, are we getting any questions? What exercises for knee pain, says Hannah?
Well, Hannah, thank you for the question. I guess that it depends on what's wrong with your knee. So the best thing to do is go and see someone to check it out, whether it's a physiotherapist or a specialist, to assess exactly what's wrong. They can guide you to the right kind of exercises. I think if you have pain, then you have to think what caused the pain. Was it something you did, like running or jumping or doing certain exercises? Avoid that for a little while, see if it gets better, and then if it doesn't, then get it checked out.
What if it's, talking about knee pain, right? So I used to run a lot, like 10 kms, and I used to do hot yoga.
Yeah.
And then one thing kind of like affected the other. You know, in yoga, you've got a single leg stand, right?
Yeah.
And whenever I did that pose, it would kind of lock my knee or lock my muscle. I wouldn't be able to straighten my leg.
Yeah.
And I noticed that when I went running and did yoga the next day. What was happening there?
Well, it's, I think not only do people need to strengthen their knees, but they also need to strengthen, the entire chain of the leg. So not just your knee muscles, but around your hip and your core. Very important particularly when you're doing all those poses in yoga. And sometimes, running, if your hip muscles aren't so strong, particularly around your what's called the abductor muscles, sometimes there are subtle dips in your leg as you run, and it causes problems with your kneecap or the tissues at the side of the knee rubbing against the side, called iliotibial band syndrome. So it's very important when you not just knee exercises, but to make sure your entire body is strong enough for those sort of exercises. So that's probably what was wrong, some hip weakness.
Ooh.
Yeah.
You seem to have quite a few things going on, Carol.
We all do, don't worry.
We do.
It's it's called living a life. I go out there, I do stuff, right? But then again, I've also sprained my back bending down to pick up a sock.
Yeah, I think, we've all done that.
There you go.
took up my
So
back.
you've done the run stuff, you've done the volleyball stuff, now you've also done bending down.
Yeah, exactly.
But as Dr. Alan Cheung has said here, look,
Yeah.
the most mundane things could lead to a serious injury. You just don't know.
Yeah, so I think that you're right, anything in life can happen, I say. So you can try and prepare yourself by strength and conditioning. So you
Right.
try and, if you haven't done a lot of exercise before, you can try and strengthen your body, particularly for that particular sport or exercise. So I shout out to my instructor at Strength Clinic Academy, Lee Withers. So he's basically, really kind of try to build me up for jiu-jitsu, do lots of specific exercises for that, grip strength and
Right.
carrying kettlebells around and things like that.
Yeah, talking of which, you're a big BJJ fan, a Brazilian
that's right,
Jiu-Jitsu fan. Tell us, how did you get into that?
It's something that I always wanted to do.
Right.
And
Why that specifically?
I used to do judo as a kid.
Right.
And then, being a doctor involves so much studying and, you have to concentrate on that. And I felt like I didn't really have the time. When I came to Singapore, it's tough to, it's difficult to play rugby like I used to. And this was a sport which was fun, exciting. You're always learning because there's so many varieties of techniques. There's that sort of physical contact and element of danger. And you have great people within the community that you'd never meet on a regular basis otherwise. I met so many interesting and fun people doing BJJ.
That's cool. I never thought about the sport and how it
Yeah.
can actually open up some doors and opportunities for you, meeting new people, like-minded people.
Yeah, instructors at Evolve, where I train, are great. Professor Carricker at Kinex and previously Teco. And they're very inspiring and, it's something I wish I had a lot more time to do, but real life.
When you're kind of like doing the whole jiu-jitsu stuff, has there been a situation when you're at the gym or wherever it is, and then someone said, "Oh, we need a doctor," like someone's injured themselves, and you go over and help them? Because
Here I come to save the day.
Well, fortunately, it's actually a relatively safe sport in that sense.
People wouldn't think that normally, right? So maybe dispel some of those myths. It's controlled in that sense, isn't it?
Yeah, I think that's, despite being a combat sport, it's got a lot of rules.
Right.
So you don't randomly expend your energy in kind of an uncontrolled way. And it's done in a very closely controlled environment. So yes, you may get some aches and pains because you've been kind of grappling, but serious injuries are quite unusual and rare, actually.
As someone who treats injuries, do you get injured yourself?
All the time, Karen, all the time.
Now we're getting to the nub of it. Okay.
Because, the thinking is you're probably a bit more extra careful, right? Or maybe not.
I'm careful of my hands. So, because
the money makers.
I mean, the reason I went into medicine in the first place was I used to play rugby and I dislocated both my shoulders. And then I thought, God, how does your body work? And I want to know more about it. And I kind of got into medicine and went down that path. But I think I've had all sorts of injuries: back injuries, knee injuries, ankle injuries, hand injuries, elbow, shoulder, you name it.
Collect them all. Collect the set.
But it honestly makes you a better doctor.
Yeah.
Because then you can say, I remember that time, I sympathize, I understand what you're going
good point.
through.
That's what is striking me about you. You're very empathetic. The first thing is, I'm so sorry you're in pain.
you've said that quite a few times today.
But that makes me feel so
and I'm sorry that you've gone through
comforted as a person or
thank
as a
you very
patient.
much.
Yeah.
Well,
all right. We're going to jump back on air in just a little bit. We've got another question about knee pain.
Oh, okay.
Yeah. All right. So Hannah wants to know how to deal with that.
Oh, you want to ask? Okay.
Wait, hang on. We're just going to go back live on air. One FM 91.3, good times, greatest hits, lovely sounds of Bruce Hornsby and The Range, the way it is. And yes, sometimes that's how we deal with our accidents and injuries, right? It's just the way it is. Just deal. Or should we not be doing that, Dr. Alan? We're chatting with Dr. Alan Cheung, who is the Senior Consultant Orthopaedic Surgeon in Singapore, Director of the International Orthopaedic Clinic at Mount Elizabeth Novena Hospital. And your areas of specialty are sports injuries and robotic joint replacement.
That's right.
Like Robocop. Like a $6 Million Man, that kind of thing.
Think of it as a friendly robot who can help heal you.
Oh, wow.
Put your knee back together.
Okay, Hannah's just asking us on Facebook Live, what kind of exercises do you do for knee pain?
Hi, Hannah. Thanks very much for the question. And I think that's a very broad question. So the best thing to do is find out exactly what is causing the knee pain. Is it something that you've been doing recently, like taking up a new sport like running or cycling or HIIT? And take a break, and then you can always see a specialist or a physiotherapist just to assess your knee and your leg. And often it's not just the knee that's the issue. It can be kind of like an entire chain of your leg. For example, like weak hip muscles or weak core. You might need to do a bit of strengthening of your leg before you can go back to your chosen activity.
And what is one thing you wish everyone would do when it comes to sports and physical activity, actually, Dr. Alan? It's a simple thing, but people don't do it.
Well, I think if I think about myself, I've ignored a lot of injuries over the years and sometimes led to problems. So don't ignore your injuries. I think that's number one. Give yourself enough rest and recovery time. I see a lot of people who like to exercise every single day, 2 or 3 times a day. I think it's too much. And just enjoy what you're doing and just have fun.
Don't ignore your injuries.
Yeah,
Carol.
I know.
Heard that now? The doc has said
She's a strong woman.
You can recap all the injuries. The long laundry list of injuries is on Facebook, actually. When should someone see a specialist? Yeah.
Well, I think that if your injury is severe, and you can't walk, or you can't use your arm, the area of injury is very swollen, deformed, and I think you should seek immediate medical attention. You might have broken a bone or dislocated the joint. Usually it's a less severe injury, but if that persists after several days, despite you protecting it and icing it, and you can't play sports, for example, then please see a specialist, as your low-level injury may become a more chronic and severe injury over time.
So, Dr. Alan, you've also been a matchday doctor for the international rugby events like the HSBC World Rugby Sevens and Super Rugby, and you're a World Rugby educator. We've talked about Brazilian Jiu-Jitsu.
Yes.
I was fascinated also to see that you're the team doctor for the Wrestling Federation of Singapore.
Yeah,
I mean,
thank you.
again, I think of wrestling and the potential for injuries.
Injuries.
But again, I think, is it like the jiu-jitsu, it's fairly controlled in that sense?
Yes, I think that, every sport has injuries, but particularly with wrestling and jiu-jitsu, it's actually relatively safe because it's done under a controlled environment and it's a sport. There are rules, okay? Thanks for going on to the topic of wrestling. I'd just like to say a big congratulations to all the athletes who took part in the recent SEA Games in Cambodia. Well done, everybody.
Well done, guys.
And particularly to the teams I support, wrestling and jiu-jitsu, who had an extremely successful outing with Timothy Lowe and Noah Lim winning golds, respectively.
Yay, well
yes. done. And I'd also like to invite all listeners to come and support our national wrestlers at the Beach Wrestling World Series competition.
Oh my gosh.
Yeah, at the Kallang Beach Volleyball Court next to Kallang Wave Mall this weekend.
Nice.
There's athletes from 35 countries coming to Singapore to compete with our national team.
This is so exciting.
That's
I've
cool.
never heard of beach wrestling. What's
so basically,
that like?
it's just wrestling in sand,
Sand
right?
just
That's
everywhere
right,
in
yes,
your face, your
everybody,
eyes,
yes, that's
in your,
right, sand.
in your outfit, your costume, your pants. What do you
So
call
you're
it?
going to be stationed there
I'm
in
going
case
to be looking
anything...
after the athletes. That's
Okay,
right, yes,
wow.
that's
What's the most common injury in beach wrestling? Is it sand in the eye?
Maybe, Carol, maybe. But I think it's going to be like some knee injuries or, some shoulder injuries from all the twisting and falling to the ground. Yeah.
Okay, so that's happening where again this weekend? Kallang?
That is happening at next to the Kallang Wave Mall.
Okay.
At the Kallang Beach.
Wow,
volleyball
right next to there.
courts.
Cool.
Yeah.
I can
Near your
Excellent.
house?
Come and have
Yeah,
a
near
look.
my place.
You
yeah.
can watch from your balcony, maybe?
Yeah, I might be able to actually, yeah.
Dr. Alan, it's been such a trip chatting with you this morning.
Thank you so much.
We hope to have you back, actually.
Yes,
Dr.
I'd love to
Alan.
come back.
Thank
It's
you.
been so much
because
fun.
we're at that age where we all get aches and pains. We want to know what we can do, how
Yes.
to fix
Still young,
ourselves,
Carol, still
what
young.
you can fix.
Don't ignore them, remember.
Also, it sounds like you can give us a live commentary of beach wrestling, He got so excited. Did you see how his face lit up?
He did.
Beach wrestling. Yes. Dr. Alan, you have a great day. Thanks
Thank
for
you
the
so
chat.
much. Thanks
Take
a
care.
lot. Have a great day.
Thank you.
The Bright Side with Carol and Lavinia
These people are crazy.
on 1FM.
Good time, great